Massive development in Chennai, with the Chennai officials admitting that COVID deaths were underreported in the city. A committee set up by the government finds that 236 deaths were not reported at all. 4th of June saw 398 deaths in Chennai, while only 177 were reported in the daily medical bulletin. Well, that's the information coming in from Chennai. Let me go across to my colleague Pramod Madhav joining us with the latest on this. So, Pramod, this is again extremely worrisome because this means suppression of data. Already, Chennai is looking at very high figures. Tamil Nadu, the worst affected state after Maharashtra. Why is this kind of a thing happening, and now how was it detected really, Pramod?
Well, we are not exactly sure, what is the reason behind these underreporting, but it was Mirror Now who actually approached the health minister with the actual data to tell, actually tell him what exactly happened. In fact, this is the only data that actually leaked from the Greater Chennai Corporation. This is an abstract from 4th June, and which actually said that the number of people who have died in 15 zones in Chennai alone was 398. But being responsible, we did not want to create any sort of panic, and that's the reason we approached the health minister, and Mirror Now actually put forward 3 questions. The first one's about this data, because on June 4th, the number of death that was informed by the Tamil Nadu government was 177, whereas the Mirror Now data that we accessed showed that in Chennai alone it was 398. Huge spike, and immediately the minister refuted, saying that there is no way of manipulating the data. But however, we also put forward 2 more important questions. The first one is that Mirror Now accessed certain mortuary cards and death cards where it was mentioned COVID positive and it was scratched off. And the second thing is that in the city of Chennai, there are 2 important hospitals, the Stanley Government Hospital and Rajaji Government Hospital, and from both hospitals, the actual death certificates of the people who had died in the hospital was not available since April. The general practice is that by 15 days, it should be uploaded in the Greater Chennai Corporation's website. Even after almost a month, those data were not available. All these information was taken to the health minister. In fact, he was shocked, but he very clearly mentioned that there is no possible way of death, death data manipulation. He took the data from us, and then later he said that he will look into it. And looks like here we have the outcome of it. That a separate committee has been created, and now they have found out that more than 200 deaths were not yet being reported, and they are trying to find out why.
Yes, so Pramod, if you can explain to us the implications of this. One simple thing we can understand, that if you underreport the number of deaths, obviously the mortality rate will show as much lower than what the actual picture is. And the mortality rate of each state is important for the overall mortality rate of the country. So a lot of policy making, containment strategy, everything depends on having accurate data. If you can give us a sense of what it would mean if you suppress the data, if you underreport, that can have some very severe consequences.
Well, it absolutely will, because for the past 4 days, we've been having cases a minimum of 1,500. Even yesterday, it went up to 1,600 reported from the state, and of which a minimum of 1,100 is from Chennai. We did not want to create any panic, but we wanted to bring out the truth, and that's the reason we approached the Corporation Commissioner, we approached the Health Minister, and we could directly ask them, is there a community spread? And if they very clearly mentioned that we do not have to worry about the numbers, because the mortality rate is very low, which means 86% of the people are asymptomatic. This is what the Chief Minister has also said. But considering the international data, when we verified, it looked like the death rate is being something was wrong with the death rate, and that's the reason when we investigated it through our sources, we found out there was such an abstract, there was such abnormalities with the mortuary card, the death memorandum and such, where in certain ones it was not reported even though it was on the card. And these things we try to immediately highlight, by which only right now they have found out that more than 200 death was not reported, which means the number, the mortality rate itself will increase from 0.72, which was informed by the Greater Chennai Corporation Commissioner, to 1.50. That itself is a very, very big deal.
Absolutely. And if 236 deaths are not reported, it is a very big number indeed, because like you said, the fatality count also then goes down from 1.5% to 0.72%. So the accurate figures will not get reflected in the national picture as well. Thanks for joining us, Pramod, with the latest information.